Welcome, everyone, to panel 4. Thank you for staying with us and sharing your time with us today. If you're just tuning in, this is panel 4, which is Moving Forward Healthcare Access and Options. I'm Dr. Jessica Shepard, Chief Medical Officer here at Verywell Health, and we're delighted that you're with us today for Your Money, Your Health. We have this panel and we have one following, so please stay tuned and learn as much as you can today. Also, to be sure, we want you to be engaged and we want you to ask as many questions as you can. This is your time to be engaged and learn more. So ask questions. There is actually a box at the bottom right of your screen. If you look for a question mark icon, you can click on that, send those questions in, and we will definitely get to those. And also, if anyone is having trouble with their live stream connection, we also recommend that you can close down some extra tabs and programs that, again, can be impacting your internet bandwidth. So without further ado, we will get started with our next panel, which is Moving Forward Healthcare Access and Options. Now, most of this time that we've spent together today has been talking about the COVID-19 pandemic, but what I have learned, even in the last panel, is that it's always good to be optimistic and to stay optimistic. So we always want to move forward and look at the future of what healthcare can look like, and also for your money, what that can look like as well. Now, we know that the pandemic took over our lives, lives of our family, friends, and individually. And for some of us, that impacted our health in so many different ways. So what we're going to do throughout this panel is explore access to healthcare now in response to the pandemic, as well as the impact within healthcare technology and also utilization on a global level. Now, when we think of the World Health Organization and how they actually define health, health is a state of complete physical, mental, social well-being, and not merely the absence of just disease and infirmity. So we've even gone as far from our platform today and from our summit today to even cover finances and how that impacts our health as well. So as we go through this panel, we're going to talk about the determinants of health from a social and economic factor, also from our physical environment. We touched on the clinical care aspect in our previous panel, but all of these behaviors together influence, again, health outcomes. So with me today, I have two wonderful panelists. We have Dr. Melinda Barnes, who is a friend of mine, but she is a double board certified facial plastic and reconstructive surgeon, as well as an ENT and Chief Medical Officer for Rowe, which is a healthcare technology company that's focused on building a patient-centric healthcare system. Thank you for joining us, Dr. Barnes.
Thank you so much for having me. Really happy to talk about moving forward and agree with being optimistic as we look to the rest of this year and next year.
Absolutely. And we have Eric Anderson, who is the president of global services at Hologic. He is going to be joining us shortly. Hologic is a medical technology company which develop products and services to advance the health of women, their families, and also their communities. So once he joins us, we'll be able to reintroduce him and also, again, discuss from his perspective the global feature of how this is impacting our health, how we can move forward, and what that really means for technology and utilization of healthcare resources. So, Melinda, obviously, I'm going to jump to you first. But from a clinical perspective, you've practiced medicine and now moving into chief medical officer position. You have seen so many different perspectives on health. But when we look at the various benefits that we have seen amplify over the last year of use of technology with telehealth, that's something that you are very familiar with. We know that usually in a non-emergent fashion or routine care, when we think of follow-up, that again allows different services to direct patient provider interaction. And also we've learned in the last panel that we had that psychological services, and when we think of emotional well-being, that has really increased as well when we think of telehealth. So looking at that and knowing that that again is something that you're very well versed in, how's the healthcare community specifically responded to telehealth when we think over the last 18 to 20 months?
Yes, that's a great question. I would say that before the pandemic, there was some hesitation around telemedicine and telehealth and whether or not quality of care could be upheld if you were seeing patients predominantly through a digital or virtual media. I think that has been dispelled and proven false many times over. And sometimes it was our own physician colleagues who were the biggest maybe skeptics of virtual care and digital care. Rightly so, they were looking out for their patient's best interests, and we've been taught a lot about laying hands as part of being able to figure out what's going on with patients. But I think what the last 18 months has done for technology is really pull the future forward. So a lot of doctors, even my colleagues that are surgeons, realize like I could actually walk a patient through a CT scan. I can prepare them for surgery. I can, talk to them about different diagnoses through the computer and through different vehicles of virtual care, whether that's asynchronous store and forward or synchronous video and phone channels. So now that a lot of people have actually experienced telemedicine on both sides, providers and patients, there's a huge amount of enthusiasm and support behind telemedicine. We now see this as there's so many benefits of telemedicine, from triaging services to being able to take care of our less sick patients via this method, so we can spend more time on inpatient care for patients who might be sicker. I like to say, think about a grandkid who's young and healthy, who needs to touch base with their doctor, and being able to do all of that virtually, which means that their sicker elderly grandparent has more time with the provider in the office and is not exposed to younger people, and then providing care in a safer location. So I think overall, one of the silver linings, if we can use that saying, of the pandemic has been the increased utilization of telemedicine and the increased acceptance of telemedicine as a high quality modality across platforms and across different stakeholders.
Absolutely. That's great. Eric, I think you are here with us now. We're going to bring him up on the screen.
Hey, Dr. Shepherd, can you hear me?
I can hear you great. We're so glad to have you jump on. I did a short intro of you previously, but now that you're here, I want everyone again to acknowledge your presence as president of global services at Hologic. It's a medical technology company, which really is a global champion in women's health and focusing on the health of women, their families, and their communities. Now, looking at where we're moving forward, which is the title of this panel, Healthcare Access and Options, we were discussing, again, healthcare now and what that response is, in specifically healthcare technology and utilization on a global level. So as president of global services at Hologic, how have you seen, the operations management or the utilization of business and services from a global perspective that has been impacted over the course of the pandemic?
Yeah, thanks, Dr. Shepherd, and I apologize for good old technology here in COVID times. My firewall here at the office in San Diego had locked me out, so happy to be here. Thanks for having us. And I think to your question, when you think of services, when you think about all the medical devices, you have a doctor, a nurse, a technologist treating a patient with a device, screening a patient with a device. On the other end of that is a massive group of customer service, technical support, and field service engineers. Just Hologic alone in the U.S., we have over 500 field service engineers that are considered by our customers as almost part of their staff, keeping them up, keeping the systems running, and avoiding that downtime, which leads to patients being canceled and things like that. So there's so much in that, and then all of a sudden there's lockdowns, right? And we had to adapt in crazy ways, being able to do things more remotely, do things safer, adjust within our system what a certain hospital or imaging center or lab had as far as their COVID protocols for accessing the facilities, because we've got to be there to help. So I think where it really woke us up is the mindset of remote servicing and all the diagnostic technology that exists. And I think some of the barriers to that, I think from an industry study, roughly 80% of the equipment out there has connected diagnostic capability to do things remotely, and maybe 15% of it's actually being utilized. And some of the barriers to that are, a big one is cybersecurity. And for obvious reasons, Colonial Pipeline, et cetera, you can see why there's hesitancy from a hospital or a health system standpoint in terms of working with vendor partners. And really, I think it's going to lead to a whole new wave of collaboration there on what we can do remotely, what we can do to monitor equipment remotely, to fix things predictively, to know some break before it breaks. And I think COVID's been a catalyst to move faster towards that. But it's been, think of service folks, they have absolutely been heroes throughout this pandemic. I think of my service team that I'm so honored to lead, never really left the front lines. And that's going to hospitals and health centers and imaging centers and labs. So important part of this and lots to do in the future.
No, I appreciate that answer, because what I've heard from both of you and your experiences is that even though we've had kind of this standstill or a surprise of a pandemic, which we haven't seen over a generation, is that you have been called to action in some form of innovation and technology that will not allow patients to be left behind or uncared for. So for both of you to answer, I'll start with you, Dr. Barnes. How is your role specifically in your company taken that leadership role when we think of innovation, technology, and moving forward when we think of healthcare access?
Yeah, so at Roe, we were really committed to making sure that our patients continue to get the care that they needed. Similar to Eric, I would love to, do a shout out to our pharmacists, our pharmacy techs, our customer support team, and our care team, and people who came in and continue to come in day out to make sure that patients get their medications, to make sure that orders are filled on time and correctly. We had no interruption in medication supply chain for patients. They were still getting their medications on time. And for us, that means something like 98% of our patients get their medications within 3 days of going through an online visit. So that's huge to continue to have that stat through the pandemic. Specifically from the chief medical officer position, one of the two things that we wanted to do during the pandemic to leverage technology was, one, we launched the first nationwide COVID telehealth assessment, which was free. As the guidelines from the CDC were ever changing and we were learning more and more about the SARS-CoV-2 virus and COVID-19, we had an online telehealth triage service where anyone could come online, answer questions, and that would triage them into low, medium, high risk. Anyone above a low risk was then connected with a provider to walk them through what to do. And if you can imagine the coordination that it took to do this across all 50 states plus DC, it was a feat. We got it launched in 4 days, starting with the states that were hit most severely and early on, which I believe was California and Washington, and then New York, where we're headquartered, and eventually we were across all 50 states. We then took that technology and partnered with over 50 different companies to do free triage of their employees. And the one that was really, extremely meaningful was our partnership with Uber to make sure that their drivers could go through a triage assessment if they felt unwell or if they had been in contact with a patient at the airport, anything like that. They could go through the triage tool for free. So that's one. And then second was we partnered with New York State to launch the COVID vaccine drive, which allowed us to vaccinate elderly homebound constituents of Westchester County. And that was another, huge effort to combine digital technology, digital product with an in-person touch. And because we have an integrated API through our acquisition of a company called WorkPath, we were able to coordinate all of this. WorkPath allows us to send healthcare professionals into the home and to do a schedule and have a protocol. So I was able to work with my team to write the vaccination protocol, how to give the vaccine, how to assess patients to make sure that the vaccine is safe for them, and then how to coordinate follow-up so that they could get that second dose. And that took a lot of work working with community partners, identifying elderly, getting translation services. We worked closely with the Office of the Aging in Westchester, as well as Meals on Wheels program, because a lot of our elderly patients, they had access to technology, but they were not necessarily Googling or searching for COVID-19 vaccines. So there was someone else who was looking for vaccination for them, and then they were able to go online and sign up and register for the program. So those are two things. And then lastly, I would say expansion of services. We heard loud and clear that people needed mental health services. It was hard to get in touch with a psychiatrist or a psychologist. And so we are very happy to, announce that we launched our Row mental health vertical called Row Mind. And so we're able to offer mental health services for anxiety and depression. And we're able to train providers and get psychiatrists on board to come and deliver this much needed service during this time of stress, a lot of change management, adjustment disorder. So I'm super happy to have responded to that as well.
Eric, what do you think from a global perspective? As a surgeon, that's something that during the pandemic we were worried about. How is that going to impact our ability to take care of patients in the operating room, making sure that supplies didn't come to a standstill? What type of instances did you see where that could have been an issue? And also, again, the same question posed to Dr. Barnes. How did your company specifically take a leadership role when it came to that?
Yeah, I think the answer is twofold. First of all, I think when Hologic has a very large diagnostics business, and really before pre-vaccine era, if you will, the call was for testing, and we stepped up, and with so many partners and our scientists here, developed two separate assays, a PCR and a TMA COVID assay, where we have now, to date since the pandemic, have shipped over 100 million COVID tests across the globe. And to do that, it was really to see the public and private sectors come together, and the work that the FDA did. Sometimes these things that take years, and the vaccines as well, coming together with a clear focus and a goal. We showed we can act quickly and effectively, and this was on display with kind of unprecedented speed with which we've seen, and we're very, very, very proud of that. We saw, I think, some great partnership there. To your question, then, to get there, think of those 100 million tests, and you don't think of on the supply chain side and supply chain constraints. So think of tubes, caps, swabs. Being able, even our vendors stepped up in huge ways, where we were able to, partner with them, help make sure they were prioritizing us, make sure we were taking care of them in terms of payment terms and all those things. So much of it goes into it. We have an amazing team on the supply chain side of things. But as a surgeon, when you think about medical devices and kind of where we're at now in the supply chain world, all segments right now of supply chain are impacted by record long raw material lead times, shortage of critical materials, rising, all those things. And just from the automotive example, Toyota cutting 40% of their finished good vehicle production in September due to supply chain constraints. And the same challenges face healthcare. And we expect to see continued disruption through fiscal year, when I look at probably through, midway through 2023, when you look at the high lead times on electronic components and chips and all of these things, all the supplier constraints, logistics, lead times, all of that, it's very real, and it's going to have a continued effect. And I think it's top of mind amongst other things like cybersecurity and other big topics. I think the supply chain issues are very important right now, and we've got to escalate things with our suppliers, looking at purchasing subcomponents. When I think about the service world and the spare parts that we've got to get into these machines to fix them and keep them running, it's a massive labyrinth, if you will, of making sure we have the right parts at the right time. That's same with any medical device provider, whether it's something for surgery or something in the lab or the imaging center. It's a huge focus.
Yeah, I'm so glad you were able to highlight that, because I think sometimes people only see the end product of what's there or what isn't there. And so specifically during the pandemic, even when it came to testing sites or the ability to test patients, obviously at the beginning we had a paucity of having the correct tools that we needed to test people. But again, sometimes the population and communities don't see that. They just see that there's nothing there. But there is such a complexity to getting all the information, to making sure that everything is structured well, even when it comes down to the smallest part of how we test people, how we're able to access people through technology, like you were discussing, Dr. Barnes. There's so much work behind the scenes. So I'm glad that you were both able to highlight the work that goes behind there, and making sure that, again, people are seeing the length of what we do in order to get the specific outcomes that we have. Now, one thing that, we have maybe the best and the worst in healthcare in the US is that we have the best of technology and access. But again, sometimes that access is disproportionate. And that's one of the things throughout the pandemic that we saw, is that it actually really highlighted the disproportionate care and disparities in healthcare that we have in the US. So I know through both of your experiences with healthcare, whether it's through technology or supply chain and devices and supply chain constraints, it really does have an impact on healthcare and that disparity. What would you say kind of spoke to you the most when we think of healthcare disparities during the pandemic, and what you would say is a great way to advance health equity?
Honestly, just seeing the difference in COVID-19 rates of people getting infected with the virus, but then also the differences in outcomes. Specifically looking at our Black and Brown communities and seeing that those, my community were more severely affected by this disease, having lower testing rates, lower vaccination rates, more likely to have a negative outcome outside of healthcare as well. So more likely to lose their job or now suffer from housing insecurity or job insecurity, food insecurity. And we also know that those are determinants of health in themselves. So now you're more likely to catch COVID, more likely to have a negative outcome from COVID. And then on top of that, that's going to affect non-COVID health issues as well. So that has been really important to me in trying to figure out how we can leverage technology to address some of these disparities. I think it starts, and it's multi-pronged approach. One is, when you have technology and you have something like asynchronous, store and forward telemedicine, that allows you to do more with less with our physician resources. I'm personally licensed in all 50 states plus DC. So that means as a Black woman, as a physician, I can see patients who are looking for a doctor that looks like them in every state plus DC. And so if you take doctors, especially underrepresented minorities that are, like you said, there's a paucity of those doctors, and you give them more access to patients by having them licensed in more states, that helps to address some of the trust issues within the community around the vaccine, around healthcare. It allows for you to have more inclusive care as you have those doctors giving culturally competent care, and then also sharing that care with their colleagues and teaching them about different community differences. Secondly, look at the homeless population in the United States, arguably one of our most vulnerable population. We know that 50% of homeless Americans have smartphones. So if you go to a smartphone and you go to our website, you can access a doctor 24/7. You can go through an online visit. That doctor can get back to you. And so again, this is how we can leverage technology, use it as a tool to help attack disparities, to help attack the problems that are facing our marginalized and vulnerable communities. And we continue to think about inclusivity, whether it comes from imagery, the actors that we use in our social media campaigns, our websites, reading level. Everything on our website is at nothing higher than a 6th grade level to make sure that everybody can understand. We talk about that with providers, making sure that they have a flexible work environment so they can come and deliver care to patients when it's convenient and accessible to them. So all of that coming together is, a multi-pronged approach. In addition to diversity efforts within Roe, we work very hard to make our employee base look reflective of the U.S. population as well. So we take our responsibility of helping to give equal care and equitable care to everyone in the United States very seriously.
I think that's phenomenal. And, at Verywell, we take that work very seriously as well. In September, we announced the launch of our Health Divide editorial series, which really addresses health disparities faced by certain communities, minority communities. And really, that is aiming to empower those communities so that they can, again, achieve better health outcomes. Eric, I wanted you to share a little bit from Hologic's perspective on Project Health Equality and what that is.
Yeah, I'd love to. Obviously, near and dear to our heart, and something that I think COVID definitely shined, to Dr. Barnes' point, shined a big light on the disparities. But it's something we've been working on. I think with COVID, we were just able to put it into high speed with, it's called Project Health Equality. And just from the background standpoint, just the staggering stats, right? That, Black women are 2 times more likely to die from cervical cancer and 40% more likely to die from breast cancer than white women. So, and then near and dear to your world, Dr. Shepard, 3 times more likely to develop uterine fibroids. So it's critical for us, there's no biological or genetic difference here. It comes down to access and awareness, access to screening and access to quality treatment. So Project Health Equality is something we've been able to partner with federally qualified health centers and some major nonprofit organizations with similar imperatives, including Rad Aid and Black Women's Health Imperative, that are going to drive access, awareness, reach, and more research as well. So we're not only focused on providing access to care, but conducting the research and spreading awareness around breast and cervical cancer, as well as fibroid treatment. So making sure in our mind, not just a quick one and done, really getting after this and making sure that the entire referral pathway, all the way from screening to diagnostics to tissue sampling to treatment, is all tremendously strengthened, because any delay in one of those lessens the chance for a successful outcome, which is survival. And, the racial disparities in health have gotten worse as access to health care became more difficult throughout COVID. So we're really putting this lives right into our passion as Hologic, as a global champion for women's health. And I know, Dr. Shepard, you've been a great partner with us here. And we're very excited about doing this and having an impact, hopefully for generations to come.
Absolutely. I think the work that we're doing now is just going to continue to rise to the expectation of what we really should be achieving in healthcare. So I'm glad to have both of you on that team in making sure that those efforts are done and also rewarded. So we only have, I'm going to probably push a little bit, like 2 minutes past when we're supposed to end, because we are really getting a lot of questions in. So I'm going to ask some questions. I want you guys to make some quick remarks so we can try and get through all of them. And I will ask a few questions and let's go. Let's do it. So our first one that came in is, why isn't the federal government, you may or may not have the answer to this, it's okay, there's no pressure. Why isn't the federal government doing more to reduce the spread? Why aren't at-home tests and high-quality masks being mailed out to every household in America? This actually could be a question for both of you, because it impacts supply, but also demand. So Dr. Barnes, why don't you give a quick answer to that?
I wish I had the answer to that. I think that what we've seen throughout COVID is just the need for coordinated efforts at the federal and state level, as well as having a clear strategy for approach to, tackling COVID-19. I think initially people thought this was here, it was going to be gone in a few months. And now we realize that you need both testing and vaccination. You need testing, vaccination, and mask. You need awareness. We need social distancing. We need a multi-pronged approach. And so getting that from the federal government, one is, what is that approach? Alignment that we needed, dissemination of that approach, I think takes a lot of effort. And it's something that in the private world, we know we can move quickly. We don't always see that effort to move quickly and innovate on the public and government side. But I think that that's something that a lot of people want to know is why, can we do more to help protect ourselves in this area?
I think that's a common theme that we've seen over the last 18 months is really the questions of why, big government getting to the small communities and the individual takes so long. And that again, Eric, from your perspective, that actually takes a lot of effort. But one of the other things that has really we've seen throughout the pandemic is the messaging. What exactly is that messaging that are people hearing? We've heard in some of the other previous panels today the politicization of actual vaccines, wearing a mask, social distancing. So even when we think of the simplicity of why can't this overall achieving effort be done to the individual level, is I think that there is effort there, and I think that there is messaging as far as evidence-based medicine that could be put into a basket, if you wanted to say, for everyone to receive in America. It's just that getting it from there to the actual person, that delivery process, there's a lot of obstacles that happen in that path. And that's still what we're battling today. So I think it's an easy task, but hard to accomplish. Eric, what would you say about that?
Yeah, I'd go back to the previous example of private and public coming together from the federal government. If the federal government had said we're going to handle all testing and be in charge of it, it would have been a disaster. And so partnering with companies, I think there's now 400 tests, COVID. Let's go back to testing. When you think about what we had to do, and kudos to our CEO and our president here, Kevin Thornell, they were on the phone every day with every governor. And including leaders from around the world, because they're just going back to the supply chain piece. It's a supply and demand issue. So trying to figure out, we installed more Panthers, which is our high throughput automated system that does the COVID testing, in the last year and a half than the previous 3 years combined. And that's that service team out there getting those installed and figuring out which labs, which states, and being able to get tests in the hands of all the right places, and knowing that there's only a limited supply, because we made as much as humanly possible, going back to the supply chain piece that I think some of the people in the government maybe didn't quite understand, going back to the example of tubes, caps, the little things that make up a test. And that's just one example. And so really coming together on that as trying to be as one team with an aligned focus and goal. That's where it's going to be, going back to the question that the visitor asked about, why can't the federal government just do it? It's never that easy, and there has to be the cohesive partnership.
Absolutely. And we're still kind of getting to that tune where it can be a cohesive effort. So we have such a popular panel going on, and the discussion is so awesome. We have one more question. They're only allowing me one more question for you two. This question is, one of the known issues with our healthcare system is that it is service-based versus outcome-based. How can online interaction with medical providers provide the preventative care needed to make our population healthier overall and not need as many services? Eric, I think you got out of this one, but this one's for you, Dr. Barnes.
Great question. At Roe, our approach has been to take a direct-to-patient, direct-to-consumer approach to healthcare, which means we are a 100% cash pay platform. We do not work with payers. And the reason for that is we want to align our incentives with the goals of patients, which means if we aren't doing a great job, people can just walk away. We're not in network. You don't have to come to us because your employer contracted with us. You don't have to come to us because the insurance company says you have to use this provider. So for us, patients come to us because we are delivering on what they're looking for, which means that we are an outcomes-focused platform, 100%. We are here to make patients healthier. We are here to help them achieve their goals. And so prevention is something that is definitely in line with our roadmap. We have to start somewhere, but when we think about where we want to be in 5-10 years, we want patients to have an integrated bundle of healthcare goals we're helping them achieve, and not think about individual services. And one of the things that we've done from the beginning is we've gotten rid of this sort of annual visit concept. You can talk to your doctor whenever you like at our platform. That can be a video visit, a phone call, it can be a secure message. You no longer have to wait for that one visit, come in with your laundry list of concerns to then talk to the doctor.
That's great. I am overjoyed at having moderated these last two panels. You guys are fantastic. With that, I wanted to end with, the question that I just gave to you, Dr. Barnes, but that online interaction, like you said, it doesn't necessarily have to be just an annual, or it really can be outcome based on, how you actually are delivered your health care and what you choose to invest as a patient towards your own health as well. But very well, we pride ourselves on having online content that allows people in their time of need to have trustworthy information that is safe, if it's evidence-based, it's vetted by physicians. And we really feel that that is also a big part of how people can educate themselves about their healthcare, about diagnoses or conditions that their family has as well. So with that being said, I thank you both for your time, for educating our listeners and our registrants today. And thank you for being a part of Your Money, Your Health in 2021. And we hope to keep this alive and see you soon. So thank you again for your insight today.
Thank you.
Thanks,
Thank
Dr.
you for having me.
Shepard. Thanks for having us.